Hello, my name is Dr. Pallab Majumder. I'm a child psychiatrist. I'm going to talk to you about self-harm.
How can the professionals working with children and young people help?
Professionals who are working with children and young people can help with this very serious issue of self-harm in many different ways. Um, Professionals can actually remain aware of this problem, that young people self-harm. They can be quite secretive and sometimes self-harm in private and hide it from the rest of the world. But the professionals can be vigilant and look for subtle signs um, of the fact that the young people might be harming themselves secretly. Um, Professionals can encourage them to talk to the young people if they feel that the young persons are struggling with their feelings, with their emotions. By talking to the young persons will help the young people feel less lonely. It will also help the young people to look at the problems more clearly or from a different perspective. Um, the professionals can demonstrate their care by listening very actively, by demonstrating empathy, uh, genuine curiosity, and an interest, uh, and also offer solutions if they share their problems with the professionals. Um, the teachers in the school can help by telling the other students to report to them if one of the young persons or one of their friends is suffering from emotional distress, or they have reasons to believe that the other young person is self-harming. Sometimes students feel that they will betray their friends if they share this with their students. But the teachers should explain to the other students that self-harm is a serious thing. It can be life-threatening, so it should never be hidden, and should be reported if they detect that one of their friends is self-harming. If the young person has already self-harmed, made an attempt to end their life or cut themselves, the professionals involved or working with the children should assess to check whether medical attention is required or not. And if medical treatment is needed, they should be taken to the hospital. Medical treatment should be accessed without any delay. Once the treatment for the physical damage is complete, the professionals involved should also seek help for the social and psychological issues that might be leading to the self-harm in the first place.
What can the parents or carers do?
The parents or carers of the young persons can help young people who are self-harming by listening to them without being critical. Now, this can be difficult for the parents if they themselves are quite frustrated and angry and upset about what's been happening. But it's very important that parents listen to them without feeling angry or critical. They should try to understand the experience of the young people, what they must be going through, and how they must be feeling. That's an attempt worth making. They should try to help the young people find out more, have more information about self-harm from appropriate sources, not from any sources, but good appropriate sources. They should help the young people look at self-harm as a problem that can be solved, not something to be ashamed of, or something to keep secret or hide. However, sometimes parents and carers themselves can be quite distressed because of what's been happening. So they shouldn't hesitate asking for help or support from other family members or their friends, or from professionals if necessary, and that's important as well.
What should they not do in trying to help?
Parents and carers should remember that they shouldn't get angry on the young persons who are self-harming. They shouldn't be trying to be their therapist, because that's a professional's role. which will be better done by professionals trained in therapy. The parents should not expect the young persons to stop self-harming overnight, because self-harm is a habitual thing which usually takes a long time to improve, and a lot of help to improve. They shouldn't make the young people promise that they will not self-harm in the future, because most of the time self-harm is driven by unconscious reasons, and it's usually beyond the voluntary control of the young person. So they should make sure that they don't put any pressure on them to have to stop self-harming.